Hello, my name is David Howell, and I'm the Director of Research at the Children's Hospital Sports Medicine Center and Associate Professor of Orthopedics at the University of Colorado School of Medicine. I'm here to talk to you today about a recent research study that we conducted in partnership with the Denver Broncos Foundation on the risks and benefits of participation in flag football among high school female athletes in the state of Colorado. Over the past several decades, we've understood that sport participation in high school comes with both risks, such as injuries, and benefits to physical, mental, emotional, and social health. However, access to organized youth sports may be limited by factors such as sex, gender, family affluence, or attitudes and fears related to sport participation. Girls and women have traditionally less opportunities to participate in team-based sports than boys and men, and may also drop out of sports at an earlier age. Furthermore, girls are vastly underrepresented in sports medicine research studies. So, understanding the risk-benefit profile of emerging sport options for high school girls represents a crucial first step toward advancing opportunities for organized sport participation for all high school students. Flag football is a sport that has grown in popularity over the past several years. While it contains inherent injury risk, as with other youth sports, it may also confer benefits in line with other youth sports. Yet, flag football may not allow for equal access for participation between girls and boys. If instituted as a sport that is available for both boys and girls at the high school level, it may provide more access for girls to participate in team-based sports. Thus, we conducted a series of studies evaluating the relative benefits and risks of flag football participation among high school girls in the state of Colorado. In this study, we found that injuries did occur, most commonly finger sprains and fractures and concussions. However, the overall injury rate for girls flag football was similar to other studies evaluating adolescent girls who participated in general physical activity, soccer, basketball, or gymnastics. Related to the reasons that participants decided to play flag football, the three primary reasons that participants described wanting to play included thinking it would be fun, thinking it would provide them some benefit, or because their friends were playing. Collectively, we use this data to present to the Colorado State High School Athletic Association Sports Medicine Advisory Committee. Along with other initiatives led by the Denver Broncos Foundation, flag football was officially sanctioned as a high school sport beginning in 2024. We also made several other interesting observations. Athletes who reported higher levels of grit or perseverance toward a task over a long period of time also reported more engagement in school. Since organized sport participation is correlated with positive academic engagement, particularly among high school girls who participate in sports relative to those who do not, we concluded that flag football participation was beneficial related to both grit and academics. Second, we observed that female high school athletes who reported menstrual dysfunction, which is reflective of underlying physiological deficits or other problems, also reported worse sleep and more stress during the season. Then, 6 months after the end of the season, those female athletes who reported continuing to participate in sports also reported higher body appreciation ratings than those who were not engaged in sports at that time. Third, we found that better peer relationships were associated with improved mental health. This indicates that peer support, such as that from a teammate or coach, may be associated with reduced anxiety and demonstrates the potential benefit of sport among female high school students, and should encourage people to seek opportunities for athletic participation in an individualized manner. Finally, we found that better sleep health, specifically the consistency of sleep quality over a season of participation, was associated with less anxiety at the end of the season. Collectively, our findings indicate while there's a risk of injury in high school flag football, there are many mental health benefits that should be considered when deciding to participate in sports or not. We look forward to many more useful findings to come that will positively impact our understanding of the benefits of youth sports for high school students and to provide additional opportunities for high school girls to participate in sports. For more information, please feel free to contact me at the information provided on the screen.